Assalamu alaikum. I'm Dr. Junaid Jahangir Abbasi. I'm a pediatrician, and today we have a very interesting case. We have a child who is 16 years old. In fact, he's no more a child, he's becoming an adult. When he presented to me, the mother was concerned that the mother actually brought a young girl of 3 months age, and the mother was concerned that since his elder sibling has something abnormal, I'm concerned that whether the girl is fine or is she has something abnormal. I asked about what is the abnormality in the boy. The mother said that I don't know exactly what is abnormal, but you may examine the boy yourself. When I met this boy, he's a wonderful boy. He's 16 years old. His name is Abdullah. And I will tell you the signs and symptoms of this boy, and you will tell me the diagnosis. अस्सलाम वालेकुम अब्दुल्ला, क्या हाल है? आपका नाम क्या है? क्या नाम है? अच्छा, इस वक्त दिन है या रात है? आपका गांव का नाम क्या है? मरी? Okay, so you can see that when we talk to Abdullah, the speech is not clear, the speech is not loud. He has produced the articulation, but the speech was not loud and clear. And this is because he has a high arched and a small jaw. Abdullah, बड़ा सा मुख खोलो, बड़ा सा आ शाबाश. You can see that he has a high arched palate. Okay, बंद कर लो. Now, if you see Abdullah's eyes, you will note that he had bilateral lens dislocation, for which surgery has been advised, but they did not went for surgery. So, for the time being, he has been given glasses. Abdullah, जरा ऊपर देखो. Okay. Then, Abdullah, अपने उंगलियां दिखाओ, अपने हाथ दिखाओ. Look at the hands of Abdullah. He is 16 years old, but his hands are abnormally tall and long fingers. He has tall hand and long fingers. Abdullah, जूती उतारें. दूसरा भी पाँव निकालें. Look at the feet of Abdullah. He has a long foot and long fingers of foot also. One of the finger has a curvature, contracture. The foot have a curvature, although these children usually have flat foot. Then I want to show you the tall stature of Abdullah. Abdullah, khade ho jao. You can see how tall Abdullah is. He is more than 6 feet. His exact height is 6.5 feet. So he is 6.5 feet. He's a tall boy. Abdullah, बैठ जाओ. He has these abnormal pigmentation on the body. Stria. These are stria. When I auscultated the heart and I inspected the chest, the sternum bone is prominent. The sternum bone is prominent, and when I auscultated the the heart, I found mitral valve prolapse, and there is a click of mitral valve prolapse. And on auscultation, the findings were of mitral valve prolapse. Then, considering the bilateral lens dislocation, the speech problem, the tall hands, tall feet, the tall stature, high arch palate, prominent breastbone, and disproportionate long arms, legs, and fingers, and bilateral lens dislocation, our diagnosis will be, of course, Marfan syndrome. Now, let me tell you something about Marfan syndrome. In Marfan syndrome, there is mutation of FBN1 gene, and due to the mutation of FBN1 gene, the fibrillin protein in the connective tissue is defective. That is the reason of a connective tissue problem in these children. So, let me also tell you that there are two famous personalities in the history who have Marfan syndrome. One is Abraham Lincoln, he was the ex-president of America, and the other is Michael Phelps. He is a famous Olympian and a famous swimmer. It is to be noted that IQ in Marfan syndrome is normal. Abdullah is not mentally retarded. He did not went to school. He is uneducated. But अगर उसकी माँ उसको कहे कि बेटा 50 रुपये हैं, आप जाएं 30 रुपये का देन ले आएँ और 20 रुपये वापस ले आएँ, तो अब्दुल्ला ये काम कर लेते हैं. इसके अलावा अब्दुल्ला पानी भी भर के लाते हैं और घर के कामों में अपनी मामा की हेल्प करते हैं. अब्दुल्ला, आप अपनी मामा की हेल्प करते हैं ना? ठीक है. और अब्दुल्ला बहुत अच्छे हैं, अच्छे से मिलते हैं, खुश मिजाज हैं, मुस्कुराते रहते हैं. अभी भी देखें अब्दुल्ला मुस्कुरा रहे हैं और मेंटली ठीक हैं. होमोसिस्टिन यूरिया में और मार्फन सिंड्रोम में ये फ़र्क है कि इन मार्फन सिंड्रोम द लेंस डिसलोकेशन इज अपवर्ड and inward, MU1, whereas in homocystinuria the lens dislocation is downward and outward. Secondly, the IQ is fine in Marfan syndrome, but IQ may be affected in homocystinuria. This video is made after taking permission from Abdullah's mother, who has happily given permission so that the other students may learn about Marfan syndrome. Thank you, Abdullah. बहुत शुक्रिया. Allah Hafiz.